To all those joining us on Facebook Live, we welcome you warmly from Andrew's Gift Foundation. Andrew's Gift Foundation is a lupus patient advocacy group with a team who are passionate about educating, equipping, and empowering lupus patients to live their best life with lupus. It's the legacy of Andrew Hughes, a lupus warrior who passed away in 2017 after battling with lupus. Una van Rijn, Andrew's mother, started the foundation in 2018. We are a patient-centered and we are pro-awareness NPO, and we offer lupus and lifestyle education, hospital visits, awareness campaigns, lupus patient and family counseling, lupus patient community groups, and emotional support. Our topic tonight, ladies and gentlemen, is lupus and kidneys. And it's an incredibly important subject to cover, as according to statistics, almost 90% of lupus patients will experience some degree of kidney disease. We're privileged to have highly skilled panelists tonight who will enlighten us on the subject with a focus on the medical, emotional, and physical aspects of kidneys and lupus well-being. My name is Daniella Djan, and I will be your host for this hour of power. I myself have been living with lupus for the past 19 years. First up on our panel, we have Dr. Trevor Germanholz. He's a specialist nephrologist at the Rondebosch Medical Center. He treats several lupus patients, such as myself, with kidney complications, and is an amazing doctor who's thorough and caring. Good evening, Dr. Gerntholtz.
Thank you very much, Daniella. Nice to be here. Thank you for the invite.
Pleasure. First question, doctor. It's a very shocking statistic that almost 90% of lupus patients have some degree of kidney disease. Why do you think this is so?
You know, it's not, as you know yourself so well, Daniella, lupus can affect any organ, but the main ones that are life-threatening are, of course, the brain and the kidneys, and those are where, you know, where the kind of risk of death creeps in. Why it affects those two organs predominantly, we know it can affect the skin, we know it can affect the joints, we know it can affect your hair, but why it affects the kidneys so frequently, I'm not entirely sure. I don't think anyone's entirely sure, but it's essentially your particularly in young women, more than men, but you do get lupus in men. It's when your body starts attacking your own DNA. So DNA is in every cell in the body. Why it affects the kidneys so frequently is a bit of a mystery.
Sure. And what's the difference between SLE and lupus nephritis?
So SLE it stands for systemic lupus erythematosus. So in the old days, they saw that a lot of people had this red rash. So the erythematosus is a word meaning redness. Lupus is just shorthand. You know, it's a quick and easy way of saying the name of the disease instead of saying systemic lupus erythematosus. It's a Latin word that means wolf, and I think it's a very nice name because I always say it's exactly like a little wolf that sometimes is awake and eating at your kidneys or your joints or your skin, and sometimes the little wolf is a quiet little puppy dog in the corner sleeping. Lupus nephritis simply means that the lupus is in your kidneys. Nephritis is a word that means kidneys.
I see. How do healthy kidneys work as opposed to affected kidneys, doctor?
So your kidneys have got three main jobs. The first job is to filter the blood of all the impurities, all the food that we eat, all the exercise that we do. Just moving our muscles generates a whole lot of toxins, and your kidneys filter that from the blood. They're supposed to get rid of the bad things and hold back the good things. The second thing that they do is they make blood. So the kidneys filter blood and the kidneys make blood. And then the third thing that they're involved with is maintenance of good bone biochemistry. The kidneys are very involved in looking after your calcium and your phosphates, which are the main minerals involved in bone formation. So diseased kidneys often have got some degree of decreased filtration. We talk about a filtration rate. Unfortunately, that only becomes symptomatic right at the very end. The early clue to lupus being in the kidneys is looking for a protein leak, because protein is in our blood and it's supposed to stay in our blood. If it leaks through the kidneys into the urine, it means that the kidneys are damaged and scarred. The other thing that often happens is, of course, a decrease in blood production, and by that we talk about anemia. And then the third thing we talk about, is bone disorders. So it doesn't matter what affects the kidneys, whether it's diabetes or lupus. I think these are some of the things that happen in diseased kidneys. As I said, the symptoms are often very, very only start coming up when the disease in the kidney is very, very advanced. And that's why in lupus clinics, it's very important to measure kidney filtering, to look for protein in the urine, to look at the blood pressure, look at the hemoglobin for anemia, look at the bone chemistry. Has that answered your question? I got a little bit carried away.
Beautifully. You've answered my next two questions, actually.
Good.
It's testing, because you said that it is a myth that you can see the symptoms early. You actually can't. And it was the case for me as well. I ended up in hospital with other lupus complications before they picked it up. So you're saying it's a good idea for doctors, for GPs and rheumatologists to check, at every
Yes.
Appointment. Okay.
Yes. So diseases that we know affect the kidneys, people who've got high blood pressure, diabetes, lupus, HIV. It's essential that you look at in the urine for protein, because that's, as I said, a very early clue that there's kidney problems. The other thing is looking at the blood pressure and looking at the kidney with blood tests as well, looking at the filtration rate. We talk about the GFR, the glomerular. That's where the filtering happens in the kidneys. F is for filtration, R is for rate. Some people do get swollen bodies with lupus nephritis, and they see blood in the urine. But not everyone gets that, and that's why it's important to test.
That's very important. Thank you for that.
Very important.
What are the treatment options for kidney disease?
So I think if we just confine ourselves to lupus in the kidneys,
yes.
Unfortunately, lupus, as you know, is what we call an autoimmune disease, where your body's defense mechanisms, particularly in women, as I said, which reasons are also not clear. It must have something to do with the hormonal profile, but your body's immune system turns in upon itself, almost makes a civil war inside your body and starts attacking the kidneys. The main treatment in lupus nephritis is therefore switching off that immune response. And unfortunately, the drugs that you need to use to do that are often very, very poisonous, and because you're kind of knocking someone's immune system out, and this is basically, a lot of the drugs are more or less like poison, and sometimes the treatment of lupus is worse than the actual underlying lupus, as many lupus sufferers have discovered. So we use drugs like steroids, we use drugs like Mycosept, azathioprine. These are all drugs that effectively knock out your immune system.
And doctor, can one go off the medication if they make drastic lifestyle changes? Is that ever possible? Can the progress be stopped or paused? Or
often these drugs need to be used for many, many months, sometimes years, and there seems to be a seasonal variation. It seems often that lupus gets worse in summer months when there's a lot of light and UV radiation, but you often can't stop the treatment completely. You can often wean it down to low levels, but when you do that, often the little wolf wakes up and starts chewing at the joints and the kidneys and the brain. So often you need to be on these drugs for many, many months, if not years, in varying degrees of high and low doses.
Sure. Can you briefly explain?
It would be very unwise to stop the treatment just by yourself in many instances.
Can you briefly explain dialysis? Does it mean that it's the end of the road for you? What?
So sometimes there are two types of kidney failure. One is permanent kidney failure, where you need to put your those kidneys will never work again, and then you need to be on dialysis, which is basically a machine that does the filtering of your blood for you, and the kidneys aren't able to do so. But there are many instances where the failure of the kidneys in lupus is a reversible failure, and if you get the treatment going kind of early enough and in correct doses, you can get the kidneys to recover. But while they are sick, you may need to dialyze temporarily until those kidneys recover.
I see. And the last question, doctor, what are your views on herbal medicines and alternative medicine?
I think that this lupus is such a powerful and vicious disease often, and often, because it's your own immune system fighting your own body, you need quite strong medication. I don't think that herbal medication can always do that. Perhaps it can be used in conjunction with these strong immunological altering medications, but I don't know if it can be used purely alone to switch off the anger of the lupus wolf that can cause such trouble. So there's definitely a place for it, and good lifestyle and healthy living. But to be used purely by itself, I'm not sure that would work, in my opinion. Although I don't know enough about herbal medicine.
So, thank you so much.
Don't want to throw shade at anyone, Daniela.
Doctor, thank you so much. I can see that you're incredibly busy. You're already in hospital, but we wish you well, and thank you so much for joining us tonight.
If there are any questions, I'm very happy for you to hand out my email there, or if you take them and you need questions answering, with pleasure. And thank you very much for this platform. Sorry it is a bit of running around.
No problem. Thank you so much for your wisdom. Thank you.
Lots of love, and go well. Bye-bye.
Bye-bye. Next on our panel is Kerry White, and Kerry White is a clinical psychologist at Livingstone Hospital in Port Elizabeth, where she works with dialysis patients on a daily basis. Good evening, Kerry. Welcome.
Hello, Daniella, and hello, everybody. And thank you very much to Andrea's gift for inviting me. I feel very honored and very privileged. And can I show you my kidney?
I love it. Kerry, your first question, what are the emotional effects of dialysis on a lupus patient?
Okay, so, we see our patients sitting in the clinic queue for months, years. They've had lupus, and now they're starting to get those, like doctor said, that, the wolf starts to gnaw at the kidney. And then one day they're sitting in front of you for an evaluation for dialysis, and it's quite a shock. It's a shock to the patient that they've got kidney failure now, they've got another complicated disease. And when I see a lupus patient that has now kidney complications, I always see a scale in my mind, and they've already got something complicated on the one side, and now we're adding another complicated disease to that side, and it feels very heavy for the patients. They feel like this is so unfair. What else must happen to them? What else do they have to go through? So immediately the first emotional reaction is definitely a deep sense of grief and loss. the loss not only of their physical well-being, but also just a loss of another role in their life, a loss of functionality, things they can't do, things now that they used to do with difficulty with lupus, and now even the world seems to be a little bit narrower. And then obviously anxiety and depression comes with the territory of having a chronic disease, as you all know. And then the other thing is that the fact that lupus is a fairly invisible disease. You only see it when it flares. And then you've already got a difficult disease, which you have to explain to people. You say, well, I've got lupus and they've got no idea what it is. Now you have to say, well, I've got kidney failure. And people still look at you like, okay, well, you look fine. So what is this kidney failure? You're talking about organ failure, you're talking about life and death situations, and people say, well, you look all right, so it can't be that bad, you know. So there's that feeling of loneliness, there's a feeling of alienation that often comes with it. And then people's sympathy, you know, you've had a chronic condition for many years, you've had lupus for many years, and people were sympathetic in the beginning. And okay, well, are you still sick? You know, and then you've got kidney failure and people are, you know, are you still sick? What's going on now? Is it another thing? Is it the same thing? Is it a different thing? What's going on? I find that a lot of people don't know about kidney failure and they don't know about kidney disease. And so it's another difficult thing that somebody with lupus has to now explain, another complicated condition that people really just don't understand. And then, yeah, the fact that it's unpredictable, lupus itself is a roller coaster. And, you know, every day brings its own challenges. Kidney failure is a different kind of roller coaster. You know, our patients on dialysis, one day they might be feeling well. They might be feeling well enough to go and work. They might be feeling well enough to go to the beach with their families. And then the next day or the next hour, they might feel completely exhausted. And so it's that unpredictability that comes with both lupus and kidney failure that's very difficult for our patients. And then, yeah, and then other things, I'm not sure if I'm answering my second question already, but anyway, I'm going to keep going because I'm very nervous. So, you know, when we speak to our patients, it's very important for us to emphasize that dialysis is a treatment and not a cure. You know, doctor mentioned that lupus is not curable. Kidney failure is also, if it's chronic kidney failure, there's you know, there's no cure for it. And so dialysis is a treatment, and as such, you have to be compliant on it. You have to work hard at it. You have to understand it. You have to be dedicated to your dialysis program. And it's very difficult because our patients are either on hemodialysis, which is the one that connects you to the machine, and you sit on a machine for, it literally filtrates your blood, and you sit on the machine for 4 hours, 3 times a week. Or you've got peritoneal dialysis, which works with fluid exchange, and that you have to do yourself at home for four times a day. And then you've got the third option, at least at our clinic, you've got APD, which is automated peritoneal dialysis, and that you hook yourself up to for 12 hours a day, and that runs through the night. So I'm the psychologist, I'm not the doctor, but this is what our patients are doing at our clinic. So it's one of those 3, and you can imagine, so dialysis itself is not difficult for our patients. Our nurses, the renal nurses train our patients very well. So it's not a difficult thing to learn, but it does take time. And so our young people typically struggle with the constraints placed on their time, you know, and they often feel like they can't go out and enjoy life because I have to get back to my exchange, or I have to go sit at dialysis. And so it makes them feel very alone, very isolated, and very alienated from their own age group, you know?
Yeah.
The other thing is body image that they struggle with, our patients struggle with, because you've had to deal with skin problems, with hair problems all your life, or not all your life, for as long as you've had SLE. And now you have to deal with catheters and fistulas, And our patients are often very body conscious. They have low self-esteem, and they worry about themselves being like physically unattractive. And their partners are scared of like damaging something or hurting them. So that's also one of the things our patients face. And then a lot of the time, we're talking too much.
No, you carry on.
A lot of the time, our patients also have questions about fertility. You know, I mean, it's difficult to speak about fertility when you have lupus, and it's even more difficult when you're on dialysis in a lot of ways. But, you know, and this is where it becomes so important for our patients to speak to their doctors. It's so comforting to see a doctor that can speak about a difficult thing so beautifully and so easily as the doctor did now. And it's very important to speak openly and have a working relationship with your doctor, so that you can feel free to ask these questions and plan for things that you plan for your goals. Yes, the other thing is, now back to my scale that I mentioned in the beginning. So when I counsel my patients, the one scale is very heavy. I mentioned all the negative stuff now. It's a lot. And it doesn't sound like there's anything good to say about somebody with lupus and kidney failure, but we have to balance the other side. And on the other side, lots of hope. Okay. And the hope that you can gain from being a patient with lupus and on dialysis is always just being aware of what your responsibility is as a patient. So what do I need to take? What medication do I need to take? What kind of medication am I on? What are the side effects? What can I expect? What do I need to do? What do I need to eat? What do I need to not eat? You know, you've got your lupus diet, you've got a kidney diet now. And then always just be 100% honest with your doctor. If you're having a bad day and you're just feeling like you don't feel like your dialysis, or you've had a bad run and you've been skipping your dialysis, the doctors can actually see that on your blood tests, and they can pick up that you've been skipping. Rather just say, you know, I'm feeling a bit down, I'm feeling anxious, I'm worried about myself, I'm not coping, and then let's, you know, there's often a social worker in the renal clinic or a psychologist, and go and chat about those problems. Don't give up. Rather speak about what the problems are, then let your doctor and your team and your renal sisters try and sort it out. Then
with regards, sorry, Kerry, can I just ask, with regards to family support, how can family support the patient, because they're with their family most, not with the doctor, you know? How can they be there for their loved one? In a way that uplift them and you know, help them in the situation.
One thing that a patient needs to remember is that as much as they are adjusting to their new diagnosis of having kidney failure, the family is also adjusting to another disease, a different like effect that the disease is having on the loved one, on the patient. So I think a lot of kindness needs to happen in the household, a lot of patience. And also, I think it's important for the patient to be educated and empower themselves regarding what is my lupus, what is my kidney failure, how can I explain this to my family? And then it would be great if the family could also take the time to Google and speak and research about what is kidney failure. Obviously, when you Google it, you're going to get the fright of your life, but keep going. and you know, and if it's possible, I know COVID makes everything difficult now, but if it's possible, make an appointment with a nursing sister, a renal sister, make an appointment with your doctor and nephrologist, and see if you can go speak to them about your own concerns, about your loved one, the patient. So that would be great. And then also for the family to understand that not every day is a great day, and you won't be able to see that it's not a great day necessarily on your patient, on the patient or on the loved one. some days, the person will look fine, but not feel great, and that's important to remember, that daddy might not be able to kick the soccer ball today. Tomorrow might be a better day, but today is really not a good day, and so can I rather play snakes and ladders, or can we rather sit together and talk about how my day was? Tomorrow might be a day for running around, but not today. And it's also important for the families to remember that the disease or the condition is only one part of a person. You can still be a great mom, a great dad, a great sister, a brother, in the house, in the family. You still have a role to play,
Absolutely.
Yeah.
Sure, Kerry, thank you so much.
2 minutes, 1 minute. The dialysis, dialysis is it gives you time to stay well, to get time to have the chance to be transplanted. And transplantation is very important. So, the goal is to comply with your treatment regime so that you can be on the transplant list, so that we can, get a kidney for you. And even though the kidney is not a cure either, it can give you a chance at a better quality of life.
So one more thing. So when you say they need to comply, are they screen for what their lifestyle is like, what the condition, how they chose, how someone is chosen for a transplant?
So there's a national transplant list. I work in a state hospital, so we've got criteria that we follow, not for transplant, but for acceptance to the dialysis program. It might work differently in private, but remember that a kidney is a precious gift, very, very precious. And so we need to know that the person receiving that kidney is, or at least not we need to know, not me, but the person receiving the kidney needs to take care of that kidney. So dialysis is a good way of showing your medical team that you are trying your best, and that you are trying to look after yourself, and that you believe enough in yourself to look after, to get a second chance. Kidneys, there's a very long waiting list for kidneys, and it's a very, very precious resource. And so you need to give yourself the best chance to be considered a match for that kidney.
Sure. And so there are obviously guidelines to get on top of that list, so to say.
Yeah, your clinic, the clinic will, and your doctor will be able to tell you about that. I'm not involved in any way about the kidney transplant list, but there are definitely not criteria, but you have to be a certain, I guess you have to be well enough to get a kidney.
Kerry, thank you so much for your time and for your valuable information.
I just say that I'm the psychologist, not the doctor. so just I'm very passionate about kidneys. So if I've misspoken, then please forgive me in advance.
Thank you, Kerry. Our third speaker is Diane Everson. She's a dietitian at Panorama Medical Center in Cape Town. Good evening, Diane.
Hi, Daniella. Thanks so much for having me.
Thank you for being here, Diane. Your first question, if you have kidney disease as a lupus patient, how do you create a kidney-friendly kitchen?
I think it's important to start with what is the function again of the kidney, which is obviously getting rid of that excess fluid and your waste products. And then also what puts pressure on the kidney. And unfortunately, it's two things that South Africans love to eat, and it's salt and protein. So to create that in the kitchen, you're going to have to look at alternatives to salt. So really, jazzing up your kitchen drawers with your spices and your herbs, and maybe even starting a little herb garden, things like lemon juice, peppers, just to make the food tasty. And then also look at how to eat less protein in your diet, or perhaps looking at a plant-based diet, which incorporates more beans and lentils, which are just as good for the kidney. But yeah, I always say, your main meal, farm-sized protein, and if you think of the average South African, that's quite a small portion. But reducing your salt protein in your diet is super important.
Yeah, no, protein, it's a big thing. I know I speak to a lot of patients and they say, yo, we can't get rid of the meat. We can't get rid of the meat. What are some of the, I mean, is plant-based, what are the healthy meats that at least we can have once in a while?
So there's definitely a big drive to plant-based eating again, which is actually super, because if you think of your beans and lentils, it is definitely a lot cheaper than your animal proteins. But we do, you know, you are allowed to eat meat, chicken, or fish. It's more about that portion. So at that main meal, more than your palm size meat, chicken, or fish at mealtime, and then perhaps a little bit less, a half palm size at your lighter meal for the day. So you can still continue with your favorite protein sources, but really just to focus on smaller portions.
Smaller portions, okay. So, you know, us Africans have different diet to the Western kind of diet. How can one compromise and how can one be able to compromise to eat healthier, but not to reject completely your African roots and what you like to eat? How do you do that?
Well, the typical African diet is actually fairly healthy. If you think about it, there's a lot less processing. It's you know, if you think of your typical Western diet, it's quite a processed diet, and a processed diet is pretty high in salt, which is what we really want to try and eat less of. So your traditional African diet, which is perhaps more your maize and your bread and your vegetables, fruit, is perfect for a healthy kidney diet, or for, you know, anybody, in fact. So nothing wrong with that traditional African diet. This, you know, just again focusing on the portion of the protein.
Yeah. All right. What about fried foods? No.
So obviously, if you want to keep your kidneys healthy, you also want to try and keep your heart healthy. So it's not that you should never have fried foods, but perhaps to rather just use a healthier oil when you're preparing your food. And then also just to watch your takeaways, where they reusing the oil with the preparation of the food. That's not heart healthy, and obviously they're not kidney healthy either.
What would you say to someone that is trying to eat healthier, but you know, it's not very accessible in terms of financial? Because is it a myth that eating healthy is expensive, more expensive than, you know, not? Or can, you know,
if you look at the price of meat products and you look at the price of your fruit and vegetables, I mean, it is expensive to eat your 5 servings of veg and fruit a day. But I try and eat foods that are in season. That's quite important. Those tend to be lower in the cost. And then your staple foods, your breads and your mazes and your cereals are, you know, they are well priced. So that's not a problem. You can continue eating that. Having a nice bowl of porridge in the morning is also a good choice for breakfast, rather than the bacon and eggs, which would be quite pricey and quite high in salt as well.
So we wanted to, Diane had just had an appointment now. So we wanted you to do a demonstration, a healthy, ideal smoothie demonstration. If you are on the Andrew's Gift Facebook page, you know that we are running a competition for the best, most ideal smoothie video. So if you haven't entered, please do so. But Diane, I want to ask you, what are the ideal ingredients for a healthy smoothie for a lupus patient, would you say?
I think the reason to drink a smoothie is because it's easy, and you can get a lot of vitamins and minerals going in a glass, which is great. And if you think of your sort of healthy kidney options, healthy lupus options, it would definitely be to go for things like your green apple, perhaps some fresh celery, which is really good to get rid of that excess fluid that you're perhaps building up. Lemon is always a good one, that's high in vitamin C. Your berries are super as well, nice and high in antioxidants. And also maybe just to have a look and see what is that, your fruit and veg, your grocer, what is in season. You can pretty much juice anything these days. You can make a smoothie with fruits. There's a lot of options. It's a lovely snack idea. But is good. So the celery is good. The cucumbers are good. Apple, berries and your lemon, just to add that bit of extra vitamin C.
Yeah, I find that it's a lot easier for me to have my veggies in a smoothie than
Absolutely.
to, yeah. So I think that's a better way of, and it's a you can take it anywhere with you, and just
Nothing
drink.
better
Thank
than people.
Yeah. Thank you so much, Diane, for joining us. It's really been very interesting. Thank you so much, and yeah, thank you. Our next panelist is Tamzin Manuel. Tamzin is a clinical psychologist at Stellenbosch University. Good evening, Tamzin.
Good evening. Thank you for having me this evening.
Oh, I love your background.
Yeah, I thought I'll just distract because I'm not actually in my office. I'm actually at so
beautiful.
Yeah.
Tamzin, can you tell us, how does a lupus patient begin to process the information that they've got kidney disease?
Yeah. As a I don't know, well, firstly, I am a clinical psychologist, but I am also a fellow loopy. So for me especially, the last 6 months, I recently found out that I'm in the second stage of having lupus, kidney failure myself. So obviously it's very difficult. I mean, you find out about your diagnosis, and then all of a sudden they add another thing on your plate, and it goes into the spiral about what next. And the first thing is to allow yourself to grieve it. Don't live in the denial of it. Allow yourself to feel it, and then decide, okay, let's make a plan. Where to next? What do I need to understand? And the number one thing is understanding what level you're in. Okay, like I said, I found out I'm in level 2, because if you understand that there are 6 stages of kidney failure, it will help you understand where to go from here, what to understand in terms of which doctor I need to see, what are the precautions I need to take, and how to look after myself. I think the biggest thing I've learned with having lupus is that I'm the expert in my body. My doctor is the expert in actually knowing the medication and knowing what is going on in terms of lupus, but I actually know what lupus feels like. And I encourage my patients, because I work obviously at the university in student counseling, and in my private practice, I get quite a few people say, you are the expert of your body. And it's actually taking that control and saying, okay, I need to take that control, and I need to say, listen, yeah, this is what's wrong with me. Because I had signs and symptoms for a while already. As you know, Andrea's gift didn't pay me. I don't know if it's fading here because of my background. But I use my lupus journal quite often in that aspect, because it allows me to take down my signs and symptoms. And I started noticing all of a sudden I was having hypertension problems, which I never had before. I was going to my GP more often. I got swelling of my feet, which, yes, I have a weight, but I know the difference between my feet swelling with my weight, and also swelling is different. So it's knowing and empowering yourself to say, listen, it's my body, and talk to your doctors about it, because doctors often don't go that extra mile and say, listen, yeah, let's check this out, and have a good relationship with your doctor. Don't be afraid to actually ask questions. My doctor always says he wish more patients had my mindset like me. I say no question's a stupid question when it comes to your doctor. And I challenge him. We will go back and forth, challenge your doctor. If your doctor's not that type, find someone that's willing to work with you in that way.
Yes.
That's the most important, because remember, you are the expert in your life. And then ask them. Challenge them if you're noticing signs and stuff going on, and you've noticed and been keeping track of your health, and you've been making changes instead of your diet, your lifestyle, and all of that. Go out and ask that. And educate yourself. Look, kidney failure is a scary thing, but even if you Google lupus, is a scary thing. So surround yourself with knowledge, because knowledge is power. That's the number one thing. I think I'm leading into my next thing, is like what to do.
Yes, go ahead.
But they linked in one. So the first thing is obviously speak to your doctor, ask him all the questions. So in the first session, you don't know everything, right? He's telling you have, especially in a private practice, because I don't go to the state, your doctors will basically just tell you, like when I got diagnosed, oh, you have SLE, don't do much on Google. You are an academic, read a bit more academic stuff, and then that's it. There's no support.
Sure.
So you're left
Sure.
in oblivion about what next, you know?
Yeah,
So
yeah.
the thing is then find out these wonderful organizations, like for example, Andrea Skiff, there are the Lupus Foundations, there's beautiful talks out there, watch videos, educate yourself about what's going on. And then write down questions for yourself and then make an appointment with your doctor and sit and ask your doctor those questions. Those are the important part. And then also important thing is about creating a network, having the people that are your support system. So for me, it's obviously, as being a therapist, I also had a therapist because that is a part of understanding myself, this new identity of having lupus, because it's a lonely experience, especially in the private experience, because there isn't support groups really. When you get diagnosed, your doctor doesn't inform you about these are the support areas they go. They just give you the medication. And like, there you go. So it's about finding out where you can get the support and the emotional support, because it is an identity thing as well. So understand and allow yourself to grieve that, and then also empower yourself. Okay. The next thing is getting your family to understand as well, because, you know, they were like, "Ah, not another thing. You know, all you do is add stuff to your bucket list. It's always another tablet. You need to take that tablet." So then also educate your family. So once you have the understanding, educate your family. And the next area is actually, if you are employed, educate your boss. That has been my most important thing for me. In the beginning, I was afraid to actually even disclose that I had lupus because, you know, it's, you know, what is my workplace going to know? But if they understand what you're actually going through, it makes it easier for them as well. So I have a thing, my colleagues would know if they're watching. I sleep during my lunchtime, okay? Because I get to a moment in the day when I'm fatigued and I need to take a nap. And
I used to do that too.
yeah, you know, you get to that point where you can't anymore, especially when the bad and you can't. And I take that nap and I allow myself that, but I disclose it to my boss. I also discuss when I am not okay. I make my colleagues aware of who my doctors are, what my medication is, in case something happens at work, as well as my close friends and my family as well. They should know who your doctors is. They should be able to go with you, even if it means taking the lupus journal with you and saying, listen, yeah, this is what my wife, my child, my partner is on. So if anything happens to you at any point, because look, I have incidents at work where my BP had been 80/40, okay? So I literally like passed out at work. My staff should be able to know, and my colleagues should be able to know what to do in that case and who to contact. So
But
this,
you know, it's interesting you say, Tamzin, because a lot of patients are scared of telling their bosses.
yes.
For you know, because in the first place they're sick a lot of the time, and then people start thinking you're lazy or you just don't want to work, or you know what, you want to get out of work in some sort of way. I know that I've had very, very supportive, thankfully, you know, bosses in the past. In fact, one of my bosses in the past allowed me to sleep in an upstairs room, you know, during my lunchtime. You know, that's how supportive she was. But not many bosses are supportive in that sense. So how do you get the support that you need if your work is not giving you that?
Yeah. And you are right. It's a very scary thing, disclosing that to your employer. For myself as well, you know. I'm supposed to be working with patients, and so all of a sudden they question your capability. You know, are you able to sit in therapy? Are you able to emotionally deal with people's stuff? And for me, the biggest thing was actually just disclosing it, because then they can learn that you're not being lazy. That you being sick is not actually just because you felt like staying at home today. And that is the important thing, is remember, you are the advocate for yourself. No one else is. And that's why it's important. I know it's scary, but try, you know. Some of them might not understand, but at the end of the day, whether you get a doctor to write you a letter, it was a conversation a colleague of mine is a psychiatrist, and we spoke about it in terms of the afternoon nap story. And then I said, I really do need this nap, but I feel so guilty because a lot of times being the lupus was that you feel guilty. You need to do something, but like, what else? And just like, you know, just ask. I will write you a letter. So if it needs be, also speak to your doctor. If you need that motivation at the end of the day. Because keeping it a secret and staying hidden actually affects you both emotionally and physically as well. And the more you open about it and actually just tell people what's going on, the more they will understand, because people around us don't understand what lupus is. It's a constant thing when you tell people, what is that? You know, I've had people, I get it from you. No, you know, it's not something you can catch, but that's part of it as well. Yeah.
Tamzin, thank you so much.
Get the journal.
Yes, I was just about to mention, thank you for mentioning it in it. Andrea Foundation, we launched a lupus journal. It's the first lupus journal in Africa, and it helps you, you know, form the bridge between you and your doctor, the patient and the doctor, and it's so incredible. It's got places to track your progress, so you see, you know, how well you are every day, your weight, how much, you know, your diet. It's an incredible resource to get. So if you're interested in getting it, you can just contact Andrea Foundation on any of our platforms. I strongly recommend it to you if you're a lupus patient. It's awesome. Thank you so much, Tamzin. That was great.
Bye.
Bye. And our final panelist is Melissa Adams. Now, Melissa is a lupus fitness and nutrition coach. She's also a lupus warrior. Now, Melissa has been in hospital for the last few weeks with a lupus flare, yet she insisted in doing this. And this just highlights the ugliness of the disease. It can attack you at any time. And, you know, you're so courageous, Melissa. You are fighting. You are really a warrior. Thank you so much for joining us, despite the difficult time you've been through in the last couple of weeks. Thank you so much.
Thanks for having me. Yeah, it's been a bit of a journey, and I think today is actually the first day I feel so much better. I can actually walk around without feeling that bad. So the swelling has gone down. I did look like the Oras Maniki, but now I'm gone back to getting back to my old self again. So I'm very happy about that. Yeah.
We're so pleased. So Melissa, you are fitness and nutrition coach. Now we're focusing on the fitness here. And this is something that not many people want to, especially lupus warriors, don't really want to talk about, because exercise is not, you know, number one on our list, but, you know, we know it's important. So we're having you here to ask, you know, what kind of, does an active lifestyle actually improve your well-being as a lupus patient and your state of your kidneys, to be more specific?
Yeah. To put it quite sweet and short, the answer is yes. And I'm a complete testimony of that. And because it just changes everything in your body. I mean, the oxygen that goes through to your muscles, relieving the blood pressure in your body, just makes everything better. And I see there is a question that was asked about depression, and definitely those good hormones that are released when you are busy exercising is very important to your healing. And we all know that kidneys, as it was mentioned before, is one of the organs that is always attacked in chronic illnesses, and it can be the worst as well. So when we exercise, the following happens. So our muscles work, right? They contract and then they need more oxygen. So this is when you start with this heavy breathing. You keep on doing that, and 2 weeks later, you're doing that same exercise. That breathing becomes a normal breath. because your body's used to it, and you've got the oxygen that it needs to carry on through the exercise, which means you've gone a bit stronger. Then what happens is you burn calories, so you start losing fat, body fat, which is also good. There's quite a bit of benefits to the exercise, and I'll go through it quickly because I know we are limited with time. So it definitely does help management of your chronic illnesses like diabetes, lupus, depression. It loosens your joints. It stretches your muscles and your tendons, reducing your pains. It increases the blood flow from your heart in your lungs, strengthening your cardiovascular system. It encourages to produce endorphins, which improves your mood. It helps regulate your sleep cycle so you can sleep better. And we all know lupus patients cannot sleep at night because of the hell that's happening in your head, you know? And and it creates this mentality of productivity in your mind. So I've read up on 3 publications that were tested, where they tested 36 patients. The one, they did a 12-month program where they did 30 minutes of brisk walking for a whole year. And the results were that the kidney disease patients, all kidney disease patients, all of them had improved muscle and arm development structure, and it did not affect the kidneys at all. The next one was a bit of resistance training, where they did the leg stretch, you know, where you do the leg extension with a bit of resistance band. There again, muscle improvement across the legs and the thighs, and the core as well. No issue towards the negativity towards the kidneys. So then they did one where they did a sedentary where you hardly did any exercise, and there was no major improvement. So that goes to show that exercise, you know what, if I could change the word exercise to movement, I think that would be better, because exercise, people tend to think, you know, sweat, blood, no, tiring, your hair. We call that, you know, sometimes our hair goes home in the colors. You know, our hair goes home because we just can't keep it in place. So movement. And when it comes to lupus, yes, it's obviously different because it manifests in different ways. I love picking up weights. It works for me. Some exercises don't work for me, some do. And for somebody else, it would be different. Some people, cycling or walking or running would work for them, but it doesn't work for me because it can be a trigger. But if we go back to the basics of training, so basic number 1, any movement, vacuuming, washing dishes, mopping the floor, dusting the high shelf, simple things like that. That is it. Movement.
So you don't need gym. You don't have to join a gym.
No, you don't need to join a gym, because I mean, you got to concentrate on paying for your meds and you know, all that other stuff that you need to focus on. Let's use the resources that we have at home. So basic movements, any type of movements at home, doing your household chores, that counts.
How often and for how long?
So I've spoken to about 3 people who are quite active. One lady is actually a ballerina, was a ballerina, and she got lupus a few months ago, and now she's struggling to walk, you know, and to be with the kids because she's always fatigued. And what I can say to that is, let's start slowly. Let's start at the starting blocks, right? If you set a goal, let's say 10 minutes, let's try and walk for 10 minutes, or let's even better, let's say 2,000 steps. So I've got a program which I've designed, which is a 15-minute walk, right? In your house, on the spot, but we are slightly kicking, we are slightly raising our arms, we are slightly doing everything, low impact training. And when I'm done, I count my steps, and I've done 2,000 steps, and I haven't broken a sweat. But it's a bit of cardio and it's a bit of exercise, and I feel better. If I do that a week later, I can probably do a half an hour. You see, so you just get stronger and stronger as you go by. So
You start
any movement,
small.
you start small. Set small goals, stick to that, achieve that. Once you feel you're getting stronger, you obviously go a step further. I must mention, yes, always do consult your doctor before you go to do any exercises, just to make sure he's clear with that, right? And listen to your body. Listen to your body. I did a course, and I spent a lot of money because I thought this is a wow course. This is going to change the world, because it's Zumba, but it's a strong by Zumba, which means it's a very high intensity training program. It was the worst mistake I ever made, because it was actually a trigger for lupus, because it was overtraining. And I could only realize that once I did it, and I did it every day, didn't listen, still went on. And then I realized, okay, no, yeah, now you're being silly. So I had to stop it, and I did it. So listening to your body is also very important. Do the right exercise.
Not every exercise is good for lupus patients. So would you recommend, so you're saying high intensity is not that great, or it really depends on the individual?
Depends on the individual.
Okay.
Depends on the individual. Yeah.
And then yoga? Yoga,
so do the exercise right is my third point, right? So very important. When you do the exercise, start light. There are YouTube videos on how to do exercises, because you can injure yourself if you don't know how to do it. Very important is always to keep your chest out, your back straight, keep your core in when you do any exercise to avoid injury. There's Pilates, there's yoga. My physio advised just to be cautious, a bit cautious of yoga, because you tend to overstretch, you overflex. Pilates is a bit more on the safer side, and swimming, of course, is a lot less strenuous on the joints. Yeah, so I've got a list of exercises. I see we are running out of time. What I can do is I can actually do a video of the few exercises I can suggest, very simple exercises.
Wonderful. Thank you.
And then, and if I can leave you with anything, in closing, I can say this is that there are 3 primary drivers for results in your life, all right? Number 1 is your luck. Okay, that boils down to randomness. Number 2 is your strategy. It's your choices. Number 3 is your actions, which is your happiness. Not your habits, your habits. Only 2 of those 3 are under your control. But if you master those 2, you can improve the odds that luck will work for you rather than against you.
Sure.
And I thank you, my fellow South Africans.
Oh, thank you, Melissa. That was so insightful. Thank you so much.
Daniella, do you want to do the poll?
Yes. So thank you so much to all our panelists. We are incredibly grateful. To our Zoom master, Terry Winship, for her wisdom, expertise, and support. We have a poll that if you can just answer, there are 2 questions. And if you can answer, did you find value tonight? Either yes, no, or maybe. And the second question is, would you like to receive future communication from us? We really appreciate if you could fill that in.
And Daniella, anyone who wants to rewatch it, they can find it on Facebook under the gift page.
Andrew's Gift Foundation. You can find the video on Facebook, the recording of this video, if you'd like to refer back to it. We don't have time to answer questions in this webinar, but we will be in contact with you via email with answers to all your questions. We want to thank Terry again. Thank you so much for everything that you've done for us. You are an amazing Zoom master. We'd also like to thank everyone for registering. We'd also like to thank Dianne van Rijn, the founder of Andrew's Gift Foundation, for her remarkable impact that you're making in the lupus community through this foundation. And we'd love to connect with you as Andrew's Gift Foundation. So please connect with us on our various platforms. Have a wonderful evening and goodbye, everyone.
Thanks, Daniela. I'm going to end the polling and then end the meeting.
Thank you, Terry.
So you can see that you got 100% people found value and about 96% people want more information, and I will send that to you as well.
That's fantastic. Thank you so much.
Pleasure. Thank you, everyone. I'm ending the meeting.
Thanks, everyone. Bye.
Bye.